Chapter 1. Hospital Corridors. Emily Harrison's small frame barely made an impression under the sterile white hospital sheets as she lay in bed 314 of Madison Children's Hospital. The 8-year-old had been a patient for 3 consecutive months, her condition a medical puzzle that had stumped the entire pediatric team. Her mother, Sarah, maintained a constant vigil beside the bed, having transformed the cramped hospital room into a makeshift home office complete with laptop, medical journals, and carefully organized binders filled with test results and symptom charts. Sarah had memorized every medical term related to her daughter's mysterious illness. She could recite Emily's medication schedule from memory and discuss complex gastrointestinal disorders with the authority of someone who had spent countless hours researching online medical databases. The nursing staff often remarked on her dedication, noting how she never seemed to leave the hospital except for brief trips to gather supplies or handle essential errands at home. Emily's symptoms followed no recognizable pattern. Sudden episodes of violent vomiting would strike without warning, followed by severe diarrhea and fever spikes that reached dangerous levels. The attacks would last anywhere from several hours to 2 days, leaving the child weak and dehydrated. Then, just as mysteriously as they began, the symptoms would vanish completely, leaving Emily appearing almost normal until the next episode struck. Dr. Michael Chen had been practicing pediatric medicine for 20 years, but Emily's case defied explanation. Every test came back within normal ranges. Blood work, stool samples, imaging studies, and specialized gastrointestinal examinations revealed no underlying pathology. The hospital's infectious disease specialists had been consulted, ruling out parasites, bacterial infections, and rare viral conditions. Genetic testing showed no hereditary disorders that might explain the recurring symptoms. The medical team had tried various treatment approaches, from dietary modifications to powerful anti-nausea medications, but nothing seemed to prevent the next attack from occurring. Emily's weight had dropped 15 pounds since her admission, her once bright eyes now sunken and dull from chronic illness. The staff had grown attached to the quiet, pale girl, who never complained even during her worst episodes. Sarah documented everything with obsessive precision. She maintained detailed logs of Emily's food intake, bowel movements, temperature readings, and sleep patterns. Her smartphone contained hundreds of photos showing Emily's condition during various stages of illness, from the initial onset of symptoms through the recovery periods. She shared these images regularly with the medical team, believing that visual documentation might provide clues that traditional testing had missed. The hospital room had become a shrine to Emily's struggle. Get well cards from classmates covered one wall, while balloons and stuffed animals crowded every available surface. Sarah had created a small library of medical textbooks and patient advocacy guides, studying them late into the night while Emily slept fitfully beside her. The constant beeping of monitors and the antiseptic smell of the hospital had become their new normal. Other parents in the pediatric ward looked to Sarah as an example of maternal devotion. She organized support groups in the family lounge, sharing resources and emotional support with families facing their own medical crises. Her knowledge of hospital procedures and her ability to navigate the complex healthcare system made her a valuable resource for newly admitted families struggling to understand their children's diagnoses. Dr. Chen found himself both impressed and slightly overwhelmed by Sarah's intensity. During their daily consultations, she would present detailed questions about treatment options, potential diagnoses, and research studies she had discovered online. Her thoroughness was admirable, yet something about her demeanor made him vaguely uncomfortable, though he could never quite identify what troubled him about their interactions. Chapter 2. The Perfect Family. Robert Harrison arrived at the hospital every evening after completing his shift as a software engineer at TechFlow Solutions, a mid-sized IT company in downtown Madison. His visits were brief but consistent, typically lasting an hour before he returned home to handle household responsibilities and check on their 14-year-old son Jacob. Robert trusted his wife's judgment completely when it came to medical matters, having always deferred to her superior knowledge of health and wellness issues throughout their 12-year marriage. Sarah had established herself as the family's medical expert long before Emily's current crisis. She maintained detailed health records for all family members, scheduled regular checkups and preventive screenings, and researched every symptom or concern with encyclopedic thoroughness. Robert appreciated her diligence, especially given his own discomfort with medical settings and his tendency to minimize health concerns that might interfere with work obligations. The financial strain of Emily's extended hospitalization was significant, but Sarah had proven remarkably resourceful in finding solutions. She had created a crowdfunding campaign that generated substantial donations from friends, co-workers, and even strangers moved by Emily's story. Her social media presence had grown exponentially, with her Facebook group for parents of chronically ill children attracting over 3,000 members from across the country. Sarah's daily posts documenting Emily's condition received hundreds of likes and dozens of supportive comments from followers who had become emotionally invested in the family's journey. She shared photos of Emily connected to IV lines, looking small and vulnerable in her hospital bed, alongside detailed updates about symptoms, treatments, and the emotional toll of their ongoing ordeal. The posts struck a perfect balance between hope and desperation, inspiring both sympathy and admiration for Sarah's unwavering dedication. Local media had picked up Emily's story, featuring the family in a human interest segment about the challenges facing families dealing with mysterious childhood illnesses. Sarah had handled the television interview with poise, articulating the frustration of watching her daughter suffer, while doctors struggled to provide answers. The segment had generated additional donations and expressions of support from the Madison community. Jacob spent most of his time at his paternal grandmother's house across town, the arrangement that had been presented as necessary to protect him from potential exposure to whatever illness was affecting his sister. The teenager seemed to accept this explanation without question, though his grades had slipped slightly since the family crisis began. His parents attributed his academic struggles to the stress of having a seriously ill sibling and the disruption to their normal family routine. Robert's mother had initially been skeptical about the extended hospital stay, questioning whether Emily's symptoms might be stress-related or somehow connected to the family's intense focus on her condition. However, Sarah had patiently explained the medical complexities involved and shared documentation from Dr. Chen's team supporting the need for continued observation and treatment. The grandmother had eventually accepted the situation, though she continued to express concern about the impact on Jacob and the family's financial stability. Sarah had transformed their home into a command center for managing Emily's care. Medical supplies filled the dining room table, while Emily's bedroom had been equipped with a hospital bed and monitoring equipment in preparation for her eventual discharge. Sarah had taken a leave of absence from her part-time job at a local nonprofit organization, dedicating herself full-time to advocating for her daughter's health and managing the complex logistics of coordinating care between multiple specialists. The couple's relationship had been strained by the crisis, though both Robert and Sarah attributed their occasional tensions to the normal pressures faced by parents of seriously ill children. Robert sometimes felt excluded from medical decision-making, but he recognized that Sarah's expertise and full-time presence at the hospital made her the natural point person for all healthcare communications. He focused on maintaining stability in other areas of their lives, ensuring that bills were paid and household needs were met, while his wife devoted herself to Emily's care. Friends and extended family members had rallied around the Harrison family, organizing meal trains, fundraising events, and offers of practical support. Sarah coordinated these efforts with the same meticulous attention to detail she applied to Emily's medical care, creating schedules and systems to ensure that help was distributed efficiently and that donors felt appreciated for their contributions to the family's struggle. Chapter 3. Suspicions. Linda Martinez had witnessed countless family crises during her 15 years as a pediatric nurse at Madison Children's Hospital, but something about the Harrison case troubled her in ways she couldn't initially articulate. Her instincts, honed by years of observing patient and family dynamics, detected subtle inconsistencies that seemed to contradict the narrative of a devoted mother, desperately seeking answers for her mysteriously ill child. The timing of Emily's episodes began to form a pattern that Linda found increasingly disturbing. Sarah was always present when symptoms began, yet she never immediately called for assistance despite her proclaimed expertise in recognizing the onset of her daughter's attacks. Instead, Linda noticed that Sarah would often spend several minutes taking photographs of Emily's distress, documenting the child's pale complexion, labored breathing, or episodes of vomiting with the detached precision of a clinical researcher. During these initial phases of Emily's attacks, Sarah would appear calm and methodical, checking her watch and making notes in her ever-present journal, before finally activating the call button for nursing assistance. When staff arrived, they would find Sarah appearing appropriately distressed and anxious, pleading for immediate intervention to help her suffering daughter. The transformation from clinical observer to distraught mother seemed to occur precisely when medical personnel entered the room. Linda began paying closer attention to Emily's behavior when her mother was absent from the room. During Sarah's brief departures for meals or errands, Emily displayed energy and appetite that seemed inconsistent with her supposed chronic condition. The child would ask for snacks that she typically rejected, engage in conversations with other patients, and even express interest in the recreational activities offered by the hospital's child life specialists. These periods of apparent wellness coincided almost perfectly with Sarah's absences, creating a correlation that Linda found increasingly difficult to dismiss as coincidence. Emily's recovery phases seemed to begin within hours of her mother leaving the hospital and would persist until shortly before Sarah's return, at which point the child would gradually become more listless and withdrawn, as if anticipating the return of her symptoms. Linda shared her observations with Dr. Chen during their routine patient conference, but her concerns were met with polite skepticism. The physician acknowledged the nurse's experience and intuition, while pointing out that Emily's condition remained medically complex, and that Sarah's devotion to her daughter was exemplary by any standard. He suggested that Linda's observations might reflect normal variations in a child's energy levels, and that Sarah's photographing behavior was likely motivated by a desire to document symptoms for medical review. The nursing staff had developed mixed feelings about Sarah's constant presence in the pediatric unit. While they appreciated her knowledge and cooperation, several nurses had noticed her tendency to hover near other patients' rooms, offering unsolicited advice to frightened parents and sharing detailed accounts of Emily's condition with families who were dealing with their own medical crises. Her behavior seemed to cross boundaries that most parents instinctively respected, suggesting an unusual comfort level with hospital environments and medical emergencies. Sarah's interactions with the hospital's social worker had also raised subtle red flags. During routine family support meetings, she would steer conversations toward her own expertise in navigating healthcare systems and her role as an advocate for other families facing similar challenges. She seemed to derive satisfaction from her status as a veteran of pediatric medical crises, occasionally making comments that suggested she found purpose and identity in her role as Emily's medical guardian. Linda noticed that Emily rarely complained about pain or discomfort, even during her most severe episodes, displaying a stoic acceptance that seemed unusual for a child her age. When questioned about her symptoms, Emily would often look to her mother before responding, as if seeking guidance on how to describe her experiences. The child's responses seemed rehearsed and lacked the spontaneous quality that typically characterized children's descriptions of pain or illness. The hospital's electronic monitoring system showed irregular patterns in Emily's vital signs that didn't correspond to typical disease progressions. Her heart rate and blood pressure would spike suddenly during episodes, then return to normal ranges more quickly than would be expected for someone experiencing genuine gastrointestinal distress. The data suggested acute stress responses rather than the gradual changes associated with organic illness. Linda began documenting her observations more systematically, noting the precise timing of Sarah's departures and returns in relation to Emily's symptom cycles. She also started paying attention to Sarah's behavior during shift changes, observing how the woman would provide detailed reports to incoming nurses while emphasizing particular aspects of Emily's condition that seemed designed to generate sympathy and concern. The nurses' growing suspicions were complicated by her professional obligations and the hospital's policies regarding family relationships. Linda understood that questioning a mother's motives without concrete evidence could have serious consequences for her career and could potentially harm the therapeutic relationship between the Harrison family and the medical team. Yet her instincts continued to suggest that Emily's illness might not be as mysterious as it appeared, and that the solution to the medical puzzle might lie in examining the family dynamics rather than searching for elusive pathological causes. Chapter 4. Investigation. Dr. Chen spent several sleepless nights reviewing Emily's case files and considering Linda Martinez's concerns about potential inconsistencies in the family's behavior patterns. His medical training and ethical obligations demanded that he thoroughly investigate any possibility that might explain Emily's condition, regardless of how uncomfortable the implications might be. The concept of Munchausen syndrome by proxy had been covered in his medical school curriculum, but he had never encountered a case that required him to seriously consider this diagnosis in his own practice. The decision to implement covert surveillance was not made lightly. Dr. Chen consulted with the hospital's ethics committee, legal counsel, and administration before proceeding with a plan that would involve monitoring the Harrison family's activities in Emily's room without their knowledge. The installation of additional monitoring equipment was presented to Sarah as an enhancement to Emily's care, designed to capture subtle changes in vital signs that might provide clues about the underlying cause of her symptoms. The surveillance system was sophisticated enough to record both audio and video while maintaining the appearance of standard medical monitoring equipment. A small camera was concealed within what appeared to be an upgraded vital signs monitor, while additional microphones were integrated into the room's existing communication systems. The technology allowed medical staff to observe interactions in real time from a secure monitoring station while maintaining complete recordings for later analysis. During the first 3 days of surveillance, the recordings showed typical interactions between a concerned mother and her chronically ill child. Sarah continued her routine of careful documentation, temperature checks, and gentle encouragement, while Emily appeared listless and uncomfortable. The footage seemed to support Sarah's version of events, and made Dr. Chen question whether Linda's suspicions might have been unfounded. On the 4th day of monitoring, Sarah's behavior began to reveal disturbing patterns. During a period when Emily appeared to be sleeping peacefully, the camera captured Sarah removing a small glass vial from her purse and carefully measuring a few drops of clear liquid into Emily's water cup. The action was performed with practiced efficiency, suggesting familiarity with the procedure. Within 30 minutes of Emily drinking from the cup, she began experiencing severe nausea and vomiting that continued for several hours. The recorded evidence was devastating in its clarity. Sarah's demeanor during Emily's subsequent distress appeared calculated rather than genuinely concerned. She methodically photographed her daughter's condition from multiple angles before calling for nursing assistance, maintaining detailed notes about the timing and severity of symptoms. Her performance for the medical staff was convincing, displaying appropriate levels of anxiety and desperation, while providing helpful information about the episode's progression. Dr. Chen immediately ordered comprehensive toxicology screening of Emily's blood and urine samples, as well as analysis of any substances found in the family's personal belongings within the hospital room. The water cup from which Emily had been drinking was carefully preserved for laboratory analysis, along with several other containers and medical supplies that Sarah had brought from home to supplement the hospital's standard provisions. Laboratory results confirmed the presence of ipecac syrup in both Emily's biological samples and the water cup. Ipecac is a plant-based substance that was historically used to induce vomiting in cases of accidental poisoning, but its medical use had been largely discontinued due to safety concerns and more effective alternatives. The concentration found in Emily's system was sufficient to cause severe gastrointestinal distress without immediately threatening her life, suggesting careful calculation of dosage levels. Further investigation revealed Sarah's recent purchase history from various online pharmaceutical suppliers and health food stores. Credit card records showed multiple orders for ipecac syrup, laxative medications, and other substances capable of producing the symptoms Emily had been experiencing. The purchases had been made over a period of several months, suggesting systematic planning rather than impulsive behavior. Hospital security reviewed additional surveillance footage from common areas, revealing Sarah's interactions with other families and her behavior when she believed herself to be unobserved. The recordings showed her displaying inappropriate familiarity with medical procedures and demonstrating detailed knowledge of hospital protocols that exceeded what would be expected from even the most dedicated parent. Her comfort level in medical environments suggested previous experience that hadn't been disclosed in Emily's admission history. Dr. Ina Chen contacted Child Protective Services to report suspected child abuse, providing them with copies of the surveillance footage, laboratory results, and documentation of Sarah's purchasing patterns. The case was assigned to experienced investigators who specialized in medical child abuse cases, ensuring that Emily's safety would be prioritized while maintaining the integrity of any potential criminal proceedings. The medical team developed a safety plan that would protect Emily from further harm while allowing the investigation to proceed. Sarah was not immediately confronted with the evidence, as investigators wanted to ensure that all necessary documentation was gathered before taking action that might prompt her to flee or destroy evidence. Emily's care was subtly modified to limit Sarah's access to her daughter's food and medications, without creating obvious suspicion about the change in protocols. Chapter 5. Exposure. The confrontation occurred on a Tuesday morning in early November, when autumn light filtered weakly through Emily's hospital room window. Sarah was arranging fresh flowers that had been delivered by well-wishers when Detective Rebecca Santos and Child Protective Services investigator James Liu entered the room, accompanied by Dr. Chen and hospital security personnel. The coordinated timing ensured that Robert would be present, having been asked to arrive early for what he believed was a routine medical consultation about Emily's treatment plan. Sarah's initial reaction was one of confused indignation, rather than panic. She demanded to know why so many officials were crowding into her daughter's room, and whether their presence might disturb Emily's fragile condition. Her maternal protectiveness seemed genuine, as she positioned herself between the investigators and Emily's bed, insisting that any discussion should take place outside the room to avoid traumatizing her already suffering child. Detective Santos methodically presented the evidence that had been gathered over the previous weeks. The surveillance footage played on a laptop computer showed Sarah's deliberate poisoning of her daughter in stark, undeniable detail. Sarah watched the video with apparent bewilderment, shaking her head and insisting that the recording must have been manipulated or misinterpreted. She claimed that she had been administering prescribed medication that Dr. Chen had given her for Emily's condition, though no such prescription existed in the medical records. The toxicology reports and evidence of Sarah's online purchases created a comprehensive picture of systematic child abuse that extended over several months. Sarah's explanations became increasingly desperate and contradictory as each piece of evidence was presented. She alternately claimed that Emily had somehow obtained the substances on her own, that the hospital staff was conspiring against their family, and that her actions were motivated entirely by her desire to help doctors understand her daughter's mysterious condition. Robert's reaction was one of complete shock and disbelief. He had trusted his wife's medical expertise implicitly, and had never questioned her decisions regarding Emily's care. The revelation that Sarah had been deliberately causing their daughter's illness challenged everything he thought he knew about his family and his marriage. His attempts to defend Sarah gradually gave way to horror as the weight of evidence became undeniable, and he began to comprehend the extent of Emily's suffering at her mother's hands. The psychiatric evaluation that followed Sarah's arrest revealed a complex psychological profile consistent with Munchausen syndrome by proxy, also known as fictitious disorder imposed on another. Dr. Patricia Williams, a forensic psychiatrist with expertise in medical child abuse cases, conducted extensive interviews with Sarah, family members, and individuals from her past, who could provide insight into her behavioral patterns and psychological development. Sarah's childhood history revealed early signs of attention-seeking behavior related to illness and medical crises. Her mother, Emily's grandmother, reluctantly disclosed that Sarah had frequently claimed to be sick as a child, often with symptoms that couldn't be medically verified. She had been taken to numerous doctors and specialists, with her mother initially concerned about serious underlying conditions, before gradually realizing that Sarah seemed to derive satisfaction from the medical attention and sympathy her supposed illnesses generated. The investigation into Sarah's first marriage uncovered troubling parallels to Emily's situation. Hospital records showed that her stepson from that relationship had experienced several unexplained medical emergencies during the 2 years Sarah was his primary caregiver. The child's biological father had ultimately gained full custody after alleging that Sarah was fabricating or causing his son's health problems, though criminal charges had never been filed due to insufficient evidence at the time. Sarah's social media activity provided additional insight into her psychological motivations. Her posts about Emily's condition had generated enormous amounts of positive attention and sympathy from hundreds of followers who viewed her as a heroic mother fighting against impossible odds. The emotional support and financial donations she received seemed to reinforce her behavior, creating a cycle where Emily's continued illness served Sarah's psychological need for attention and validation. Dr. Williams explained to the court that individuals with Munchausen syndrome by proxy often possess extensive medical knowledge and appear to be exceptionally devoted caregivers. They typically target victims who are vulnerable and dependent, using their authority and apparent expertise to gain access to medical settings where they can continue their abusive behavior while receiving praise for their dedication. The syndrome has a mortality rate of up to 10%, making it one of the most dangerous forms of child abuse. Robert struggled to understand how he had failed to recognize the signs of his wife's psychological disorder and the abuse of his daughter. The guilt and self-recrimination he experienced were common among family members who discover that a trusted caregiver has been systematically harming a loved one. Counseling helped him understand that Sarah's manipulation had been sophisticated and that her medical knowledge had made her deception particularly convincing. Emily's reaction to her mother's arrest was complicated by her age and her psychological conditioning to view herself as chronically ill. She had been told repeatedly that she had a serious medical condition that required constant vigilance and treatment. Learning that her suffering had been deliberately caused by her mother required extensive therapeutic support to help her process the betrayal and begin to understand that she was not actually sick. The legal proceedings moved forward, with Sarah facing multiple felony charges related to child abuse, reckless endangerment, and fraud in connection with the donations she had solicited based on false representations about Emily's condition. The strength of the evidence, including video surveillance and laboratory confirmation of poisoning, made her conviction highly likely despite her continued claims of innocence, and her attorney's attempts to argue that her actions were motivated by genuine concern for her daughter's welfare. Chapter 6. Recovery. Emily's discharge from Madison Children's Hospital occurred on a crisp December morning, exactly 4 months after her initial admission for what everyone had believed was a mysterious gastrointestinal disorder. The medical team had monitored her carefully for 2 weeks following her mother's arrest, documenting the complete absence of symptoms once the source of toxins was removed from her environment. Her appetite returned, her energy levels normalized, and the pale, sickly appearance that had defined her hospital stay gradually gave way to the healthy complexion of a typical 8-year-old child. The transition home required extensive preparation and support services. Robert had undergone emergency custody proceedings to ensure Emily's safety while demonstrating his ability to provide appropriate care without Sarah's involvement. Social workers conducted thorough evaluations of the family's home environment and Robert's parenting capabilities, ultimately determining that Emily could be safely returned to his custody with ongoing supervision and support services. Jacob's return home marked another significant step in the family's healing process. The teenager had spent months believing that his sister was dying from an incurable disease, and learning the truth about their mother's actions required extensive counseling to help him process his anger, confusion, and guilt. He struggled with conflicting emotions about Sarah, whom he still loved despite her actions, while also feeling protective toward Emily and supportive of his father's efforts to rebuild their family. Emily's psychological recovery proved more complex than her physical healing. She had internalized her identity as a sick child and initially expressed anxiety about no longer receiving the intensive medical attention that had defined her daily routine for months. The transition from being constantly monitored and cared for to resuming normal childhood activities required gradual adjustment with support from pediatric psychologists who specialized in trauma recovery. Dr. Sarah Kim, a child psychologist with expertise in medical trauma, worked with Emily to help her understand that she had never been truly ill and that her suffering had been caused by someone who should have protected her. The therapeutic process involved helping Emily distinguish between real and fabricated symptoms while rebuilding her trust in adults and medical professionals. Play therapy and art therapy provided safe ways for Emily to express her emotions and process her experiences without being overwhelmed by the complexity of adult motivations and legal proceedings. The family's financial situation required significant restructuring following Sarah's arrest and the revelation that much of the donated money had been obtained through fraudulent representations. Robert worked with legal counsel to establish a restitution fund for donors who had contributed to Emily's medical expenses based on false information about her condition. Many donors chose to allow their contributions to remain with the family to support Emily's legitimate therapeutic needs and the family's recovery process. Robert's employer, TechFlow Solutions, provided additional support through their employee assistance program and flexible work arrangements that allowed him to prioritize his children's needs during the recovery period. Colleagues and friends who had initially supported the family during Emily's supposed illness continued their assistance once they learned the truth, though some relationships were strained by the revelation and the questions it raised about how such deception could have continued undetected for so long. The criminal trial proceeded through the Wisconsin court system, with Sarah ultimately pleading guilty to multiple felony charges, rather than subjecting her family to the trauma of a lengthy trial. The plea agreement resulted in a 12-year prison sentence with requirements for psychological treatment and prohibition from unsupervised contact with children following her eventual release. The judge emphasized the serious nature of medical child abuse and the lasting trauma inflicted on Emily and her family. Dr. Chen incorporated the Harrison case into his teaching responsibilities at the University of Wisconsin Medical School, using it as an example of the importance of maintaining awareness of non-medical causes of symptoms and the need for healthcare providers to remain alert to signs of potential abuse. The case became part of the hospital's training program for residents and nursing staff, emphasizing the value of multidisciplinary collaboration and the courage required to question family dynamics when patient safety might be at risk. Linda Martinez received formal recognition from the hospital administration for her professional vigilance and advocacy on behalf of Emily's safety. Her willingness to voice concerns despite potential professional risks had been instrumental in uncovering the abuse and protecting Emily from further harm. The case reinforced the hospital's policies, encouraging staff to report suspicious patterns and supporting employees who advocate for patient welfare, even in difficult circumstances. The media coverage of Sarah's conviction brought national attention to Munchausen syndrome by proxy, and the challenges healthcare providers face in recognizing this form of child abuse. Emily's story became part of advocacy efforts to improve training for medical professionals and to develop better systems for identifying and responding to suspected medical child abuse. The family's experience highlighted both the devastating impact of this disorder and the possibility of recovery and healing when appropriate intervention and support are provided. Emily's recovery continued gradually, with regular check-ins from social services and ongoing therapeutic support to address the long-term effects of her trauma. She returned to school with accommodations to help her readjust to normal childhood routines and peer relationships. Her resilience and the strong support system provided by her father, brother, and extended family offered hope that she could overcome the psychological impact of her mother's betrayal and develop into a healthy, well-adjusted young person, despite the extraordinary circumstances of her early childhood.